In 2019, unfortunately, we have continued to see an escalation in healthcare costs for both small and mid-sized businesses. Wages have increased, and with those increase in wages is also an increase in benefits. And we're once again seeing an increase in the number of uninsured in America.
The largest challenge is probably labor. We've seen across the board increases in both wages and benefits. Walmart just came out and said they're going to pay truck drivers $87,000. Well, if you're a small and mid-sized business, how are you going to compete?
How does this affect the employer? Well, there's always a cost shifting that occurs. And the employer indirectly ends up paying for the healthcare costs of these uninsured patients.
As we know, the 27 chronic conditions represent about 83% of the medical spend. So if we're really going to get to reducing costs, improving outcomes, we really have to hold people accountable. Now, from an employer standpoint, what you can do is provide narrow networks or give incentives for employees to go and get physicals and drug screenings, so we limit the propensity for chronic conditions.
As you've heard me say before, these costs are not going to be controlled until employers and groups of employers banding together get directly involved. They must demand transparency in both cost and quality. A good example of quality is the use of opioid-sparing methods to treat pain.
What we're going to see in 2019 is more risk assumption by the providers. We had this old model, fee for service. It hasn't worked, and we have to have the providers step up and put some of their quality standards in line for either remuneration or just total transparency.
Forbes predicted that in 2019 the healthcare industry will shift from big data analytics to small data, meaningful analytics. Meaningful small data is a shift to a more specialty and condition-specific set of analytics that allows providers to track variability in care among providers, or to track the progress of a single patient who has a specific condition and whether their symptoms are improving or getting worse, in order to be able to intervene early and prevent complications from ever happening in the first place.
Digital health technology catering to out-of-hospital settings will grow over 30% to cross $25 billion globally by the end of this year.
This comes in two forms. First is in helping patients navigate their clinical care and really helping them understand what's coming next so that they can be an active participant in their care. The second is in engaging patients in the financial management of their care. Patients are increasingly responsible for up to half of the cost of their care, and the more they are involved in decisions around their care, they're in a much better position to contain the cost of that care for themselves, for their employer.
Consumers are ready for healthcare to mirror other parts of their lives in terms of convenience, choices, and affordable options with predictable pricing.
And the IT is also catching up with this consumer-centric movement, and it's not just a nice-to-have, but a must-have.
In this year, we'll see an increase in remote patient monitoring, telehealth, and mobile and wearable solutions. Companies like Airbnb, Amazon, and Uber are giving consumers more control of their lives. Technology innovators will need to partner with leading-edge healthcare delivery systems like Coordinated Health.
What we are learning is that the more patients are engaged and involved in their care, the better their outcomes, and the better our chances are of avoiding unnecessary costs, which everyone is interested in doing. 2019 is really shaping up to be a truly transformative year for the industry.